Welcome to our channel, to another mind-blowing video. The first diagnosis of the respiratory disease caused by the novel coronavirus was in Wuhan in Hubei Province, China, in December of 2019. The virus quickly spread throughout China and to the rest of the world, and declared a pandemic on March 11, 2020. Now, the number of confirmed cases has topped 107 million, including 27 million cases in the. Here are 10 things you need to know about the novel coronavirus. Number 1. The novel coronavirus is named SARS-CoV-2, and the disease is COVID-19. SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2, because the virus is very similar to the SARS coronavirus first discovered in 2003. The SARS-CoV-2 disease is COVID-19, for coronavirus disease 2019. Number 2. The first cases in the United States were mainly in people who traveled from China. Some of the first known cases of COVID-19 in the United States were in people returning from travel abroad, from China, cruise ships, and subsequently from other countries with COVID-19 spread. These are so-called imported cases. On February 25, 2020, the CDC, Centers for Disease Control and Prevention, diagnosed the new coronavirus disease in a person who lives in California, but who had no known travel history or close contact with an infected person. These community cases because they did not arise from a known source. Number 3. The novel coronavirus spreads very easily from person to person. SARS-CoV-2 spreads through tiny respiratory droplets from the nose or mouth when an infected person coughs or sneezes. The droplets can make contact within 6 feet. You can contract the coronavirus if these droplets land in your nose or mouth, you inhale them, or you touch a contaminated surface or object and then touch your nose or mouth before washing your hands. The virus also spreads through the air under certain circumstances, such as in enclosed spaces with poor ventilation. Infected people are contagious before symptoms develop. That is pre-symptomatic transmission. Studies show the virus multiplies fast in the nose and throat, even in the beginning of an infection when the person does not yet feel ill. Infectious disease experts estimate a significant number of people, 25 to 50%, are infected with the virus, but never develop symptoms. Asymptomatic and pre-symptomatic people still shed the virus and are capable of infecting another individual. Number 4. Social distancing and wearing a mask helps slow the spread of infection. You can do your part to slow the spread of COVID-19 by social distancing, which is avoiding large public gatherings and keeping a distance of at least 6 feet from other people. Stay at home or shelter at home policies to slow the spread of the new coronavirus work. However, as people grow weary of restrictions and re-engage, coronavirus cases rise. Because the virus can spread through the air in poorly ventilated, crowded spaces, you should avoid indoor public spaces to limit possible exposure to infectious particles. Wearing a cloth or disposable surgical mask over your mouth and nose helps limit the amount of respiratory droplets you release into the environment when you talk, sneeze, and cough. A mask also offers some protection to you. Everyone wearing a mask in indoor public spaces reduces person-to-person transmission of the virus. That is because you could be infected and not know it. Wearing a mask reduces the chance of unknowingly spreading the virus to others. Masks are also important outside, where you may encounter other people, and you cannot maintain a social distance of at least 6 feet. Number 5. COVID-19 symptoms range from mild to severe, and it can be fatal. The common cold is also spread by a coronavirus, as well as other types of viruses. For some patients, coronavirus symptoms mimic those of a common cold, while others experience the same symptoms that accompany a severe respiratory infection. COVID-19 symptoms include fever, cough, body aches, sore throat, fatigue, phlegm, production, and shortness of breath. An unexpected symptom of COVID-19 is loss of sense of smell. In some cases, the virus attacks the lungs and symptoms are severe enough the patient requires hospital care with supplemental oxygen and fluids. COVID-19 symptoms appear within 2 to 14 days after exposure. The risk of dying from COVID-19 is greater in people who have underlying chronic health conditions, such as obesity and/or heart, lung, or liver disease. If you want to support us, please subscribe to our channel. Number 6. The FDA approved the first targeted COVID-19 treatment. The FDA, Food and Drug Administration, recently approved the antiviral drug, remdesivir, Veklury, for use in hospitalized COVID-19 patients. The drug is not specific for SARS-CoV-2, but it has been shown to speed up recovery time in clinical studies. The FDA also approved the first targeted COVID-19 treatment, a monoclonal antibody, mAb, called bamlanivimab, for patients with mild to moderate COVID-19 at risk for severe disease. The drug is specific for the virus's spike protein, interfering with how the virus infects cells. The mAb cocktail former President Trump received has also been approved for high-risk patients with mild to moderate COVID-19. Research and development continues on other treatments. Many drugs are in clinical trials. In the meantime, hospitalized patients receive appropriate treatment for serious respiratory symptoms and other disease complications. Doctors are giving some patients plasma donated from recovered COVID-19 patients to help the patient fight the infection. The death rate of COVID-19 has decreased significantly since the pandemic first started, based on data from more than 5,000 hospitalizations at a 3-hospital system in New York. In March, about 25% of hospitalized COVID patients died. By August, the mortality rate was 7.6%. If a person with COVID-19 does not require medical care, they should stay home for 10 days since symptoms first appeared, wear a mask and self-isolate from others in the household, and restrict any activity outside the home to prevent transmission. Number 7. COVID-19 vaccines will be widely available in 2021. 2 COVID-19 vaccines were approved by the FDA in late 2020, and several more are in late clinical trials. Healthcare workers and long-term care facility residents are the first recipients, followed by people at highest risk for severe disease and essential workers. Vaccination of the general public will occur throughout 2021. Number 8. The source of the novel coronavirus is linked to animals. Because many patients in the Wuhan, China outbreak were linked to a large seafood and animal market, the 2019 coronavirus was thought the virus spread directly from animals to humans. However, once in humans, the virus was able to spread person to person. This is similar to the spread of 2 other coronaviruses that originated from animals, SARS-CoV, civet cats, and MERS-CoV, camels. There are many different coronaviruses. They mainly infect animals, but some of the viruses can spread from animals to humans. This is the case with SARS-CoV, MERS-CoV, and the new coronavirus, SARS-CoV-2. All 3 viruses came from bats. Number 9. The novel coronavirus is mutating. Variations, or mutations in the novel coronavirus are occurring on a regular basis, as the virus passes from person to person. This is normal for viruses. In most cases, mutations have little effect. In others, they can have a dramatic effect, like the variant first discovered in the United Kingdom. The UK, or B.1.1.7 variant, spreads 30 to 50% faster than the original virus, which is causing a rise in UK COVID-19 cases. Vaccine researchers are optimistic the COVID-19 vaccines will protect against the UK variant, but they may be less effective against other variants, such as the Brazil and South Africa variants. New vaccines are in development. Number 10. Get tested for COVID-19 if you have symptoms. If you have symptoms of COVID-19, contact your doctor about getting tested for the virus. The U.S. Department of Health and Human Services has a list of no-cost testing sites by state. If you were close, within 6 feet for more than 15 minutes, to someone who has COVID-19, contact a healthcare provider about what type of diagnostic COVID test to take and when. Keep in mind there is an incubation period for the virus. Even if you got infected, your COVID test will be negative until you have enough virus to be detected, regardless of symptoms. It's best to wait about 5 days from the time of close contact to take the test. Stay home and avoid in-person contact if possible, while monitoring yourself daily for signs and symptoms of COVID-19. Call your healthcare provider if you develop serious symptoms, including difficulty breathing. If you get tested and the result is negative, you may end quarantine after 7 days, as long as you did not develop COVID symptoms during quarantine. For the most recent information about COVID-19, check the CDC website for updates, including the number of confirmed cases and advice for travelers. Call your state's public health department for local information. Some states have set up phone hotlines. Thank you for spending some time with us. If you would like to support us, make sure to like the video and subscribe our channel so you will never miss another video. See you next time.